health regulators are recommending that the U.S. temporarily halt the use of the Johnson & Johnson vaccine. In a joint statement, the CDC and the FDA announced they are investigating reports of potentially dangerous blood clots not on the list of potential adverse side effects that were part of the emergency use authorization. Plus, the FDA is explaining how it's reviewing Pfizer's request to expand its vaccine to children aged 12 to 15. That's your COVID-19 alert. Now it's time for the new normal.
Right now, I'd like to stress these events appear to be extremely rare. However, COVID-19 vaccine safety is a top priority for the federal government.
Of the nearly 7 million Johnson & Johnson shots administered, health officials are looking into 6 cases of blood clots in female patients after one woman died and another is in critical condition.
If you look at the time frame when this occurs, it's pretty tight, from a few days, 6 to 13 days from the time of the vaccination.
So if you received the Johnson & Johnson vaccine, do you have cause to be concerned? What the nation's top infectious disease doctor has to say.
The president has always said that this is a wartime effort. We're at war against the virus, and as such, we've mobilized a wartime effort so that we're prepared for a wide range of scenarios.
The impact the Johnson & Johnson pause will have on President Biden's push to get 200 million shots in arms by his 100th day in office. The new normal starts now. This is the new normal. I'm Rich Barabi. Right now, state health officials in New York, New Jersey, and Connecticut are pausing the use of the Johnson & Johnson vaccine after the CDC and the FDA recommended the pause while they look into claims of blood clots in half a dozen women who received the single-dose shot. News 12's Marcy Rubin is outside a Johnson & Johnson facility in Piscataway, New Jersey now with the very latest for us. Marcy.
And Rich, Johnson & Johnson's world headquarters are based right here in New Jersey. And tonight, the world is keeping a close eye on this drug maker and its COVID-19 vaccine.
We had about 100 patients scheduled to get Johnson & Johnson vaccine.
Just like thousands of clinics across the nation, Medicine Man Pharmacy in Hoboken had to cancel plans to administer 100 Johnson & Johnson shots today. Most patients here are already rescheduled for the Pfizer shot later this week.
It's better safe to be, than sorry, right? So it's nothing to lose in just pausing something for like few days and just take a back and just take a look at the data again.
And that's exactly what our federal health agencies will be doing as they call for a pause on the use of the J&J one-dose COVID-19 vaccine after 6 cases of a rare but severe type of blood clot, including 1 death, were found. All the patients, women between 18 and 48, and the blood clot occurring 6 to 13 days after vaccination.
Right now, I'd like to stress these events appear to be extremely rare. However, COVID-19 vaccine safety is a top priority for the federal government.
Respected health experts, including Dr. Anthony Fauci, are calling the pause an abundance of caution, reminding the public, especially those who recently had the J&J shot, how rare these 6 cases are out of the near 7 million doses administered.
We want to get this worked out as quickly as we possibly can, and that's why you see the word pause. In other words, you want to hold off for a bit, and very well may go back to that, maybe with some conditions or maybe not.
And he says that is all up to the FDA and the CDC. And this pause, Dr. Fauci says, could last days. It could last weeks. He also says those who have gotten the Johnson & Johnson vaccine have very little to worry about. We are in Piscataway, New Jersey. Marcy Rubin, News 12.
All right, Marcy, thank you very much. So there is quite a bit of angst about this. So let's ask the question, what do you do if you've already received the Johnson & Johnson vaccine? Well, here are the steps federal health officials say you should take. The FDA and CDC say individuals who received the Johnson & Johnson vaccine should be on the lookout for specific symptoms. Those include severe headache, abdominal pain, leg pain, or shortness of breath. Officials say if you have experienced any of those within the 3 weeks of getting the shot, you should contact your doctor for guidance. However, officials stress that adverse effects from the Johnson & Johnson vaccine are, quote, extremely rare. Dr. Anthony Fauci says if it's been more than a month since you got the Johnson & Johnson shot, then he says you should not be concerned. He says the time frame for side effect symptoms appears to be 6 to 13 days after you get the vaccine. Now, the CDC is hosting an emergency meeting of its advisory committee on immunization practices tomorrow afternoon. The panel will review the rare and severe blood clot cases among people who received the Johnson & Johnson shot. The virtual meeting is set to run from 1:30 to 4:30. The FDA will also review the ACIP's analysis as it investigates the cases. Now, the White House says the Johnson & Johnson pause will not impact the president's push to get 200 million shots in arms by his 100th day in office.
The J&J vaccine makes up less than 5% of the more than 190 million recorded shots in arms in the United States to date.
Officials say the nation has secured enough Pfizer and Moderna doses to vaccinate 300 million Americans by the end of July and are now working with state leaders to get anyone scheduled for a J&J vaccine rescheduled now for a Pfizer or Moderna shot. The U.S. probe now prompting Johnson & Johnson to delay its coronavirus vaccine rollout in Europe. The company says it's reviewing the reports of blood clots with European health authorities. The delay, really another blow to the vaccination efforts in EU countries. They have been riddled with supply shortages, logistical problems, and concerns over, unusual blood clots in a small number of people who received the AstraZeneca vaccine. So, are you concerned about COVID vaccine safety after the decision to pause the Johnson & Johnson shot over blood clot fears? You see, this is a hot topic issue on social media tonight. So many people sounding off about this. We have a poll on our News 12 Twitter page. We invite you to certainly go on there. Let us know what you think about this. Do you feel comfortable with this or not? And then we'll look at the results later in this show. While you're there, leave us a comment as well. You see, we'll be cycling through them and we will share them on the air. Join the conversation online. That's where our Amanda Bossert and a panel of experts will be taking your questions in the commercial breaks. Okay, joining us now to talk more about the feds calling for a pause in the use of the J&J vaccine is Dr. David Regelmann of Hartford HealthCare St. Vincent's Medical Center in Bridgeport. Doctor, thank you for joining us. I'll be very upfront about this. Should people be concerned about the Johnson & Johnson shot if they've received it?
Well, at the risk of bearing the lead, I first want to recognize the monumental accomplishments that these vaccines really represent. Moving from identifying the molecular biology of a pathogen all the way to not just one, but several effective methods of prevention in about 8 months is an incredible testament to human ingenuity and a cause for great celebration. I think that Dr. Anthony Fauci probably put it best. If you're outside of that 13-day window, there's probably not a huge amount to be concerned about. This is truly an abundance or perhaps an overabundance of caution that the FDA is exercising. And I think with good cause, pausing to review the data again when these kinds of events arise. And just to put it in perspective, again, we're talking about less than 1 per million who have received the Johnson & Johnson vaccine are experiencing this cerebral venous thrombosis. So that's compared to, in the general population, that particular problem arising about 13 cases per million. So I just, exercising caution among specific populations, particularly women of childbearing age, is probably prudent, but we'll have more information, I think, when the outside advisory committee meets with the CDC tomorrow. So that should be an interesting discussion.
Doctor, authorities say they've got plenty of Moderna and Pfizer doses on hand, but are you concerned that there could be an increased sense of vaccine hesitancy here? Again, we're talking about 6 cases among more than 6 million, but still people see the headline on pause and many get concerned.
Yeah, I think that's a much more dangerous outcome, Rich, of this possible adverse effect signal detection process. It would be just that, an increase in vaccine hesitancy and or decreased trust in the scientific and medical communities. On the contrary, I would argue that the caution that the FDA, that Hartford HealthCare, and several other institutions are demonstrating by exercising this pause in the administration of the J&J vaccine should bolster confidence. But we'll see what the conclusions are after tomorrow's meeting.
Okay, and so then lastly, your message briefly for people who maybe are on the fence and now tilting one way or another after hearing this news.
Well, I'll put it very, very bluntly. We are in a race against this disease, particularly against the increasing case numbers in several areas of the country and against the development of dangerous variants of apparently increasing transmissibility, increasing virulence. So as we continue to gather data on the remarkable tools we have available to prevent and to treat COVID-19, currently our best strategy to end this pandemic as quickly as possible remains to vaccinate as many people as possible as soon as possible.
All right, Dr. Regelmann, thank you so much for your insight. We appreciate it.
My pleasure.
Health officials in the tri-state seeing a rise in the infection rate among college-age residents. What's being done in one state to hopefully make it easier to get shots in arms. But will the effort be hampered now by the Johnson & Johnson vaccine pause? And let's take this conversation online as well. Our Amanda Bossert is moderating a panel of guests on Facebook Live. Amanda.
Yeah, Rich, a lot of comments pouring in on our Facebook Live right now, reacting to the J&J headline today. And we're going to speak with one man who got the shot exactly 2 weeks ago about how he's feeling, about how he's reacting. And we also have doctors standing by ready to answer your questions right now. Join us on Facebook Live.